Hi, this is Pamela Worth with the Hello Health Moms Empowered podcast. Today I have Dr. Karen Molano. She is a clinical psychologist specializing in infant, family, and early childhood. And she combines traditional psychology with Eastern medicine and holistic health practices to guide parents in raising emotionally resilient and cognitively capable children. Thank you, Dr. Molano, for being with us.
Thank you for having me. It's such a pleasure.
So, tell us how you got into bringing these pieces together between psychology, Eastern medicine, holistic, what that means to you, what that means to families and to parents out there, and how to, think about all of this.
Absolutely. I've been working with families and children for over 20 years now, which is so hard for me to believe that it's been that long, but it's my passion. Working with kids, families has always been my passion. And two big things happened in my life that really led me to integrate all of it. One of the things was just seeing how children were getting younger and younger and younger and sicker and sicker and sicker. We would get children where a month old and they had anxiety and depression, which often people don't realize that they can have it, but they can. So that was one piece is that while I feel like I do very impactful work, it just wasn't enough for me. I thought there has to be another way, especially because we grow up and we're constantly having to change something, reverse something, reprogram our brains. Like what if were able to really program them differently from the beginning? The second piece was as an adult, once I got my doctorate, I really wanted to be a doctor when I was a little kid. I didn't know what kind, but I also really wanted to be a mom. That was so important to me. And once I was finally ready to do that, I had issues getting pregnant. I struggled with infertility, and it was the worst time of my life because it was the one thing I thought my body could do as a female, and I couldn't get pregnant. And then working with kids was the constant reminder that I didn't have one of my own. And so that led me to really look into Eastern medicine and start trying different things. And not only was I finally able to get pregnant, but all of these ailments I had, from physical ailments, headaches, migraines, backaches, emotional difficulties, all of them just started to lift and just started to go away. And it really felt like magic. It felt like voodoo or something really unique. And so I started deep diving into that world, and I started learning about the impact of nutrition and gut health and toxins on the brain and how it affects the way we feel. And so I started to bridge all of that together, really wanting to reverse engineer the way we raise kids and how we parent so that we can raise children that can really tap into that unlimited potential that we all have right from the start and just grow up with a better quality of life, different trajectory. And for parents to really have that clarity and confidence to parent that I feel we often lack because there's just not a whole lot of direction when we become parents.
Yeah, no, that's super. And my journey was I was very, very fortunate when we were dealing with our son that I found a neurologist that taught me about the gut-brain axis and the impact that certain prebiotics and probiotics and helping the body detox and things, it most of what's happening in the gut will travel up, but it won't travel back down. And so talk to us a little bit about how when you're working with families, where are some of the places that you like to start? And from our experience, it takes a long time. And so you've got to be really patient and, kind of talk about that journey that you take your patients through.
Absolutely. And because my goal is really to focus on pregnancy in the first 5 years, that's how we can really reverse engineer it, is really starting from the moment of conception. Because you're absolutely right. The longer we wait, the older we get, our bodies are magical and our brains are very malleable and can shift, but it just takes so much longer. It takes so much longer to see the difference, the results. But when we start right from the beginning, before we've set those habits, as the brain is forming, as those little organs are forming, it's completely different. It is so much easier. So, starting from the moment of conception, really, I like to look at the whole picture as opposed to just looking at, okay, your brain and how you're feeling and your mindset, which is a lot of what, let's say, a psychologist would focus on, is on those emotions. I look at 8 dimensions of health. I created a method that looks at the whole system so that we can optimize the brain, the body, and the heart so that we can get them to work together in alignment so that they can do what they do best, which is really help us to thrive. So it's a whole body, mind, heart experience where we look at where you're at in that moment in time, what your lifestyle looks like, what's going on in your life, and we create a method, a blueprint, I like to call it, that's very specific to you and your family and your children that are so incredibly unique, because I don't believe there's a one size fits all. And there's so many great techniques and tools and things that are out there. But what I noticed is there's always a gap. We have all these tools and then we don't implement them. So there's this gap as to the why is it that we don't? Kind of like when we want to lose weight or go to the gym and we know what to do, but we're like, oh, I can't get myself to the gym or I can't do these things. There's always something, a belief or something in there that keeps us. So I like to focus on that gap so that we can really customize things to what a family is ready for and where they're at. And we could do it in a way that is sustainable and break through whatever beliefs, whatever barriers keep us from stepping more into who we really are as humans.
So what sort of, and I love that you've got the 8 dimension methodology.
Mhm.
Do you find that you touch on them in pieces and in phases so that it's not a lot at one time, or do you really say, here's really what we're going to do, and here's where I need you to start, and we're gonna, and then you've got the entire family, right? So you've got, parents and siblings, and maybe kind of touching on where this process kind of goes and how it touches everyone.
And that's a really great question. And this is where I think it just really depends on the family. When I can look at the overview and can really sense where a family is at, then we can focus on what matters most to that family, what is in alignment with them, because I might have an agenda of my own. Absolutely. Do I? There's always something as a psychologist, as a healer that I want to get people to. But if you are not ready as an individual to take another step, it's most likely not going to work. Or if I recommend something to you that isn't in alignment with who you are or what you believe in, it's also not going to work. So to me, it's really important where we have, think of it as a buffet. You walk into a buffet and it's overwhelming amount of food, but you can walk around, you can take a look, you can taste something. You're like, that's okay. I guess I'll put it on my plate. And you may not even eat it. You might not. And so we start with an approach where it's very focused on that family, and that even that'll shift because maybe in that moment in time the focus might be on, say, mom and child because they're the most ready to start, and then we might incorporate dad or grandmother. It's always a goal to incorporate the whole family because the more family that's involved, that trajectory for that child that we're focusing on is going to be much, much easier. But again, it's really going to depend on the family, what they're ready for, and really understanding where they're at and the level of energy that they have to even invest. I have clients that are all in and they could do things super quickly. Like, I'm ready to do all this. And I have some that they're, it takes a little bit longer because they're not ready. There's a lot of fears and there's no right or wrong. But I really listen to where that family's at. And based on that, then we have specific recommendations, absolutely. But we're always going to gauge to make sure that it really resonates with that family. If not, we're going to tweak it because there isn't any right or wrong here. It's more about really listening and following that family's journey so that we can implement a plan that's sustainable, that makes sense to them, and that they can feel and believe that they can follow through with it.
Yeah, and talk to us a little bit about the length of time. I mean, it takes a lot of time to undo all the toxicity and all the, to give the body enough time to start to repair itself, even with the right nutrients. And,
Mhm.
um, for us, it was almost 2 years of continuing. We were very, very lucky to have found a family psychologist who also understood what we were going through. And the thing I loved about her was that she would not only meet with, the child, but then she would meet with the sibling and then the husband, the mother, and then all of us together so that we all kind of could talk about, because we all had different perspectives on how this was affecting us. And um, which I think is really, really awesome that you're taking an entire family approach. And but it took us a long time. And so, in your experience, how long does it kind of take for people to kind of start to see some changes and really to have that permanent change?
Absolutely. And again, the earlier we start, the better. When we're starting in the womb, the likelihood is that you're going to see changes pretty quickly once that little one is born because you're starting so early, and you might not be experiencing the same, colic and sleep difficulties and that the things we experience as new parents, even when we bring a baby home, because we're not just working on the gut and on the brain, but we're also working on the experience of what it means to transition from maybe not having kids to having kids or having more children and that whole unit of the family. So when the younger, the faster you're going to see changes. But in terms of speed, what I notice is that it is a journey. I don't claim to do things quickly or overnight. That I don't believe that that's what parenting is about. Parenting is about being able to have tools and have the ability to see things from a different perspective and be able to go with the changes. Because the minute that you master something, as you master something and boom, it changes again. You're like, oh no, now I have to learn something else again because whatever I just did, now my little one's a little bit older and they're growing and I have to learn a new skill. So I believe in following a family from conception through those first 5, 6 years of life so that we can be present for them, not just for the downs, but for the ups. And so while you're going to see changes, and when you incorporate everything, the whole ecosystem, you see changes a lot faster. I have families that see changes within a day, some that see changes within a week, depending on what we're focusing on. But again, we're human, life happens, things happen, development is different at every age. And so the idea is to be able to provide families with a place to come to that they can trust, that they can continue on that journey and feel that support ongoing without feeling like, all right, I'm just going to solve this problem and go away. And now I'm stuck with another problem because it's one problem after another after another. And I believe that at the root of all problems is disconnection. Problems happen because there's disconnection, whether that's disconnection from yourself, from a higher being, whatever you believe in, from your children, from your family, from the world around you, from nature. Whenever there's a disconnect, then problems come up. But if we can really focus on the root of that connection, how can we find a way to continue to connect more and more? So it's a muscle that we have to exercise. It's a journey, it's a lifestyle. And so I claim to help walk parents through that journey. And my programs are meant to do exactly that, to provide you that support, whether you need to jump in and jump out or come in as much as you need to and not feel like you're stuck with the overwhelm of the too much information overload that's out in the world, not knowing who to listen to, what to trust, and knowing that they can come to a place where they can still be who they need to be and live a life that they feel like they can align to, but still have access to information that's reputable, that's valuable, and that they're going to be able to mold into their families.
And do you find that you're able to do some of this remotely? Do you do everything in person?
I do everything remotely as of right now. And so what I've done is I've combined from my 20 years of experience with not just as a professional, but where I see gaps as a parent myself, all of the different aspects of parenting, of raising children that parents have been asking for the 20 years I've been working with them. And a lot of times I was very constricted to what I could do because I worked in settings. I worked for the county. I worked for organizations where we could only do so much. And so I listen to all the gaps. What are the things that parents are constantly asking for? What are the things that I've been able to implement in my everyday work that everyday parents don't have access to? There's a lot of things that we use in our world that very, very few people have access to. They have to have some sort of diagnosis or disorder in order to be able to utilize them. And I think that's really sad. There's so many tools and we can't get them out in the world. That makes me sad. So how can I bring what so few people have access to parents as a whole out in anywhere in the world? And so I incorporate a curriculum that grows with you, where it's partly, think of it as in coaching in a box where it's still at your pace, at your style, where you're not just learning, but you're having a transformational experience within that learning process. I do it all. I think, okay, we're all really busy as parents. So how can we make it as easy as humanly possible? I put everything in an app. And then I also have that live component so that it can keep coming back and listening to the community as to what is it that they need right now, the people that I'm serving. How can I continue to serve you with what you need? And that may be things like, I want to go on a trip and I don't know how to travel with an infant and a 2-year-old. So I'm not going to travel at all. I think we can, of course, do all these things if we have a roadmap, if we have that support. And so I bring all of that in a community where it's a combination of online programs that you do at your own pace, as well as having a live component virtually with other people that are like-minded and in a similar situation. And then I bring other components that are more objective, like measures to see where your child is, so that we have actual objective measures that we can use to implement that roadmap that is much more specific to your family. And so it just depends on the level of hand-holding that families want, because I can hold as much of those hands and really customize things to that child. Or we could do it more where the program is designed for you to be able to walk into that buffet and really create a lifestyle roadmap with the way I've set the program up for parents to go through it.
Oh, that's super. So, assuming, as- assuming someone listening is pregnant or knows someone that's pregnant, can you tell us a little bit about what the 8 dimensions are, so that they would then understand, whether or not that would resonate with them?
Absolutely. The 8 dimensions of health. Well, it starts with the parent. I noticed that a lot of services in the world are very focused on the children, which is lovely and great. And that's typically what we're looking for, but we often ignore the parent. So I get a lot of parents that say, you're just giving me another to-do list. I can't do this. This is too much. And I couldn't agree more, because as a parent myself, there are times, even with all the tools and everything that I know and I provide, I'm still a parent too. I'm still a mom. I still have a child that I have to raise. And there's moments where it's tough, where I'm not in my best. And so that first dimension is really focused on mindset and the parent and how we think, how we view the world, and what are some of those belief systems that hold us back from moving forward, from doing the things we love, from being able to have more ease and joy and flow in our parenting life. The next dimension is really focused on understanding brain development, because once we have that knowledge and understanding of how a little brain develops and how the things we do on an everyday basis impact that child, now we're empowered to make choices that make sense based on the age of that little one and how they think. Not only does it help the child, but it helps us understand how we process information and how we experience life. So that's another dimension. Then we go into the social emotional development, which is what most people are used to in identify psychologists with, where we're looking at all the different types of development and functioning and how they feel. And I walk through parents through pretty much any problem they could have, whether that's sleep or toileting or they're not listening, crying, whatever it is, it's all incorporated in that. It's almost like an all-in-one system. Then we look at cognitive development. So looking at the piece of learning and cognition. So how can we teach our children in a way that's fun, that's exciting, that is really going to help their brains grow and tap into that creativity and learning? Because I know as parents, we want our children to learn as much as possible and to be successful and do all the things that they want. So we really focus on, okay, now that we understand how the brain works, now we learn a way to teach that is more effective. Then we go into nutrition and gut health, We go into environmental factors. So thinking of toxicology and how toxins impact our bodies and our brains, down to even how the colors of the room will impact the way we feel. So we make it fun too, helping to even design those nurseries and the rooms or the spaces that our children live in. And being out in nature and in the environment and how we can integrate it in a way that is really going to help children tap into that unlimited potential that they have. And then we go into movement and the importance of movement in the body. And then finally, we look at reduction of stress. So when we bring all of these things together in a way that's sustainable, manageable, that it makes sense, where we take little bits of all of it for where the family is at, and you see the whole picture. Now we have a recipe that is not just going to help manage everyday problems, but really focus on the root of it all, which is, okay, really, why do we want problems to go away? Well, we want our children to grow up with more joy and more ease. We want to have a better parenting journey. We want to live lives with meaning and purpose. So when we incorporate all that, we're raising our human potential IQ so that we can make more empowered choices that make more sense for our families.
That's great. Um, what sort of words of advice do you have for people that are listening?
Words of advice. I could probably go on that one all day long. I think what I notice the most, and when I hear parents, is this fear that they're not enough, that we're not doing enough, that we're not good enough, that there's just so much more. And then we really dim our lights and thinking that we can't become those beings. And the reality is that we already are. We already are enough. We already are incredible, amazing parents. And it's not about doing more. It's about empowering and understanding who we are so we can step more into that human being that we already are and embrace and allow so that things can be easier. They're not supposed to be this hard. Parenting isn't supposed to be hard. It can be a lot easier than we believe.
That's wonderful. Thank you so much. Any other last pieces that you want to touch on?
No, I think this has been great. I think if anybody's interested, I'm Lumi Tot on social media and website. That's super easy, LUMITOT. And I'm more than happy to provide anybody with suggestions, support, anything that we can do to help the parenting world a little bit easier. I'm always here to help.
That's wonderful. Thank you so much. Really appreciate everything, doctor. And we'll be sure to add everything in the show notes as well.
Thank you.